Today, our community spotlight features LINC Idaho, and LINC is the Living Independence Network Corporation. And our presenter in the community spotlight today is Lana Gonzales. And Lana is the Director of Independent Living Innovation. And she is going to be sharing with us information about how she and her team and the entire team at LINC work with people to help them live as independently as possible. And one of the things she is going to be talking with us about is the low medical equipment and refurbished wheelchair ramp loan program. So at this point, I am going to turn it over to Lana.
Hello, everyone. My name is Lana Gonzales, and I am the director of our independent living program. LINC is a Center for Independent Living, and our independent living program is just one of the services we provide. So I'm going to talk a little bit about all of those. But the first thing I want to talk about is some of our guiding principles at LINC. At LINC, we believe that people with disabilities should be able to live as independently as possible as they choose. We honor an individual's choice to live where they want to live and how they want to live. So independent choice and their choice is a critical part of our program. They keep us moving. They come to us and we work with them in setting goals. So independent living choice for the individual is a critical guiding principle of our program. Another principle that's very important to our program is the dignity of risk, and that people sometimes are going to try things and it's not going to work out. And that's okay. That's how we all learn, right? Dignity is risk, is we have the right to fail. Sometimes people that we serve that have disabilities don't always get an opportunity to fail because people feel like they have to prevent them from failing. And we believe that people can make mistakes and that's how they learn. So these principles of individual choice and dignity of risk really guide the services that we provide for people. So we are always keeping those principles in mind when we're working with individuals to help them reach their level of independence that they want. And the way that we help people live independently is through several different programs. I'm going to leave the equipment one for now. We're going to come back to that one. One of our smaller programs, but really, and I don't know if you guys serve the Twin Falls community, but we have a transportation in Twin Falls. We have a transportation program where we supplement transportation taxi to get out into the community. Individuals with a disability apply for that service, and then they pay a minimal copay to be able to get to the doctor's office, to Walmart, to do the grocery shopping, or even a book club. So they get several of those rides a month, and that's a service we're able to provide in the Twin Falls area. So that's really helpful for those in that community that don't have a public transportation system, and it helps them get to the things they need to get to in Twin Falls. Another one of our programs that's ongoing is advocacy. We work with individuals to help them learn how to advocate for themselves, as well as systems advocacy. We help train them and work how to speak with a legislator, how to work together as a team to make their information known about what it's like to live with a disability, and inform legislators that are guiding the laws that are made. So that we work with it because we feel like an individual's voice about how they live is the most powerful when working with lawmakers. So that advocacy program is a crown jewel for me. It's a very important program. We really like it. We believe that there should be no decisions should be made about anybody without their input. And lots of times we feel like people with disabilities don't get to their voices heard. And this is a really great way to get their voices heard, so that people are making choices for them with their own opinions in mind. So that's an important program as well. We have an information and referral service. We have an individual who answers the phone. So if someone is looking for a particular resource, our information and referral specialist takes the call, helps provide them with community resources that are available to them, and then determines if they need additional assistance. So sometimes people call and they just need quick information about where to get rental assistance, or they don't know where to find a list of providers or things like that. And we are able to get them connected with those quickly. And sometimes they need a little bit more intense help. And in those cases, our independent living specialists work with them to reach a particular goal. And that goal may be living in the community. They're living in a skilled nursing facility, and they would like to move into the community. We help them put together a plan of what they would need to do to be able to transition out of an institution into living into the community. So that can be a long process, especially right now with housing being a problem. There isn't housing, and the housing that is available is very expensive. But we do our best to help work and encourage them and work on getting people that transitioning out of those kinds of places. So that program is also really important. Lots of times people get stuck in institutions, and that affects their mental health, and being part of the community is really critical to having a diverse community. So we want to help people get out of those situations if it's possible. So our most commonly used program, which Mary talked about already a little bit, is our equipment program, our mobility equipment program. So we have a large inventory of equipment that's been donated to us, and then we have a mobility specialist who takes that equipment and refurbishes it, and then we redistribute it to those in need. So this is power wheelchairs, mobility scooters, walkers. We have so much equipment that people might need when they're transitioning out of an institution or having surgery, or their grandma's in town for the week. So we're able to provide people manual chairs, like all kinds of equipment that people might need. We have an inventory of that. And our staff, what people could call up and see if we have but we don't always have everything we want. Like one of the things that's most commonly asked for is those knee scooters. I don't know if you guys have seen those knee scooters that are very popular. People always want those. So if you have one sitting around your house, you want to donate it to us, I promise you we can find someone that needs one of those. So we have this inventory of equipment that we're able to redistribute to people in need, so that they don't have, if their insurance doesn't have it or they're not able to obtain it, we can quickly get them that equipment. So that's also really nice. Another barrier that sometimes when people are trying to live independently is getting out of your house is a problem if you're using mobility equipment. So we have a ramp loaning program. That program, we provide modular ramps, bring them to people, and let them borrow them or rent them from us so that they can get out of their house while we help them find a permanent solution if the permanent solution is required. So we need to find out if their insurance would cover it. So we help work through that. If they need to use a community resource to build a permanent ramp. So that's a little bit, that program is also very popular program for helping people live as independently as possible. So that's real quick synopsis of some of the programs that are in their independent living services. But I cannot brush over the fact that we also have a personal care services program, which people have the opportunity to hire and train and schedule their own care. So we don't do that for them. They get to choose their own individuals to come and work in their homes, hire them, and our personal care services works with them to pay the individual and work with their insurances. So we also have that personal assistant services as well at LINC. I don't know as much about that program because I don't run it, but it is a really important service that we provide. I'm sorry, I think I missed a question. No, there is no equipment. There is no requirement to loaning equipment. We loan equipment all the time to people. Most of the people that come to us have a disability of some sorts, but that certainly is not required to loan the equipment. There isn't even an application process, and we do have a lot of equipment. So we would encourage you. We did a liquidation event this summer, so we would encourage you to tell people about that program. Do we have any other questions?
I'm going to ask a question if you don't mind. This is Mary Millett. Talk to us a little bit about if a person does make a request for, a piece of equipment, what kind of timeline are we looking at, from the time that they may call in and ask about it to the time they can actually, get it?
That's a great question. Mary. So we distribute equipment on Tuesdays and Wednesdays. So if an individual needs equipment, it's best to call in advance, and then we would have those available on a Tuesday or Wednesday. They can pick that up that equipment. And sometimes it depends on availability. So for example, like I was talking about the knee scooter, if we don't have a knee scooter available, we would put you on a wait list and then call you as soon as one was donated. So in those cases, it sometimes takes a little bit longer, but under normal circumstances, if you called me on when a Thursday, you would have to wait till Tuesday to get the equipment, but you can get it fairly quickly if we have it in inventory. That's a great question.
And all right, Lana, thank you for your question. And
Lana, I've got one more question for Lana as well.
Okay.
Do you take donations of even the smaller, like grabbers and those kinds of things for durable medical equipment? And either way, how do people contact you to make a donation? Because I think we sometimes hear about people who have items to be donated.
So calling our main number would transfer you to our independent or our information referral specialist, who would be able to make that reservation for you. That's fairly.
And what's that number? I'll put it in the chat.
It is 208-336-3335. And that is for Caldwell area, Twin Falls area. It's for all of the areas that we serve.
Okay.
And it also depends on the availability of that equipment. So
sure. And smaller items as well, or no?
Oh, I'm sorry. Yeah, I knew I was missing another question. So smaller items we do take depending on if we have an influx, we may not have it. So calling Kelly and getting that scheduled, she can let you know if we're not taking those right now. But sometimes we take them anyway, just because they have other things that we take. But like if they had a knee scooter and little things that we already had, we would totally take it so we can get the knee scooter. So it really does. Most of the time, we'll take most things. Most things.
Very good.
I know we don't need crutches.
Okay. Everybody wants a scooter. No more crutches.
Yeah. Scooters are definitely the most popular item that people would request. We have the most electric wheelchairs. And of course, the difference is the handlebars, right? A wheelchair doesn't have handlebars. Scooters are the trendy thing. Everybody wants to be cool in a scooter. So that is the most requested. At lift chairs, we get a lot of requests for lift chairs as well, though. Those are fairly popular. People like to be able to help. That helps people stand up. That's sometimes the first thing that they need assistance with. So lift chairs are also very popular. I'm sorry, Mary, did you have another question?
No, actually, Dara, that was the question I had, was one, how to make the contact, and then anything around donations.
Yeah, Terry Potter is our mobility expert. So most of the time you can talk to him. If not, you're always welcome to call and ask for me. I'm happy to get you connected as well.